The Southern Arizona VA healthcare system is also exploring more holistic care options for veterans. It was recently designated a VA Whole Health flagship facility. Treatment can include acupuncture, meditation, and yoga, with a greater focus on listening to patients' concerns. We learn more about what options veterans have from Dr. Anthony Stazzone, the Southern Arizona VA Chief of Staff.
Whole health is looking at the veteran where they're at, the whole community they live in, their set and setting for their spiritual, medical, as well as mental health needs, and wrapping that around. Some of it involves such things as complementary medicine, such as meditation, yoga, all those alternatives, and it touches them in mental health, but also other aspects of their health care, because, as you know, a disease state doesn't just affect that one organ or that one aspect of the veteran. It affects the whole aspect of their life, their family, and whether or not they're going to be compliant, what they can do to manage their health more effectively. It effectively empowers the veteran.
We have 500,000 veterans reported to be living here in Arizona. Are we talking just urban or rural areas? Where are we in providing care to every veteran who's in the state?
There's three general areas of service. There's Northern Arizona, there's the central area which Phoenix VA serves, and there's Southern Arizona, which we're here in Southern Arizona VA. We have a city-based services or urban services at the main VA with some urban CBOCs. They call them community-based outpatient clinics, and that's on the northwest side, southeast side, and even in Green Valley, which is close to Tucson. We also have these clinics available in rural areas, so Yuma, Sierra Vista, Safford, Casa Grande. Part of the mission of the VA is to have clinics to outreach where the veterans are and not make sure they don't have to travel so much distance to get at least foundational services such as primary care or mental health.
The VA really working hard to expand its services, but also giving veterans more of a choice in their care. Tell me about that.
In 2014, they enacted the VA Choice Act, or VACA, and that allowed veterans for certain wait times of 30 days or more for an appointment, or 40 miles, or for unusual or extraordinary benefits to get services right there in their local communities. It was a bill that was put through in response to some things that happened in the media with the Phoenix VA. That bill was an imperfect bill. It was meant as a stopgap measure, and it's continued for the past several years. Currently, the VA is looking to expand that, and there's a new act called the Mission Act coming through. The VA has always collaborated with the community. We have good ties with the University of Arizona and all of our other community hospitals, and this just kind of makes it easier for the VA to facilitate care on the bureaucratic end for those veterans and make sure we do the right thing for them.
There's some level of criteria that individuals have to meet in order to get service.
There is for medical services. For mental health services, we'll always be able to be there for any mental health crisis. We will give, regardless of what your level of eligibility is, we'll make sure we get you services.
It seems like there's less of a stigma associated with treating PTSD nowadays.
I think it wasn't termed PTSD, so we've given a name to it, and I think many folks will realize that from World War II, the common term my father's generation would use would be shell-shocked, and they talk about being shell-shocked or things. Military sexual trauma is an aspect that we wasn't previously given a name nor addressed, and I think we've realized that, particularly with our influx of women veterans now. It's one of our fastest growing populations. So giving names to things and recognizing the problem, but I think it's been there, and now I think it's just the fact that we also have better ways to recognize it and treat it.
Are you seeing a decline in suicide rates as a result?
Well, it's interesting. Suicides, there's always a number, about 22 suicides a day they mention. If you look at those suicides, actually about 16 of those are done with veterans not connected to the VA whatsoever. There's a much lower rate if veterans are connected into the VA mental health services for suicide than those who are not. So with all of the resources we have, absolutely. I think the no wrong door to mental health is one of the aspects we're looking at with doing that. We have same-day mental health services, and also just looking at this whole health aspect, really meeting them in their disease states where they're at. They may not have mental illness, but they may have chronic disease that needs to be managed and approached in an effective way to deal with that chronic disease before you get to a point where suicide comes into the equation.
Earlier you mentioned the controversy surrounding the Phoenix VA. Where are we in restoring trust?
You know, trust is one veteran at a time. I don't think you can do one thing or say one thing to earn trust. I think actions speak louder than words. Any complaint we take seriously. I'll use the Tucson VA for example. We have over nearly 60,000 veterans we manage every day. We can do things right 95% of the time. That still leaves 3,000 veterans that are unsatisfied with what happened. We need to make sure we find out what occurred, reconcile that, not just for that veteran, but for future veterans. So it's really the interactions we have with our frontline staff, and as somebody who's in a management position, making sure that we're setting the example of what we expect for veteran care and following that up and really walking the walk, not just talking the talk.